So the prevalence of sexual pain really differs based on which study you read. So it can range anywhere from 3 to 24% of the general population, 45% upwards in older women, and then also studies looking at younger women up to 34%. There are also some studies that report sexual pain at nearly over 80%. And so pretty widely variable in terms of how prevalent this condition is, but it doesn't necessarily seem to affect a specific demographic in terms of ethnicity or age. It's something across the spectrum, across the age spectrum and life experience spectrum. It seems to affect women of all ages. So there are several factors that we want to be aware of when it comes to sexual pain related to both kind of biomedical factors, physical factors, and then also psychological and emotional factors as well. And so obviously the first reason people seek care for their pain is because they hurt, and because this pain is having some sort of an impact not only on their sexual function but also potentially on their physical function. It can also be affecting their relationship with their partner. Unfortunately, majority of women that suffer from sexual pain disorders oftentimes don't receive the most appropriate care for a few different reasons. Number one, sexual pain is still a pretty taboo topic in our country. People typically don't talk about it. Up until recently, it wasn't recognized as an actual disorder. And so with the change in nomenclature to genitopelvic pain penetration disorder, it helped sort of legitimize this condition as an actual disorder. Secondly, there are feelings that women have of self-stigmatization or self-shame about this condition. They feel ashamed because they're not able to have intercourse, because they're not able to enjoy intercourse. They are anxious and they worry about the impact it's having on their partner and on the relationship dynamics with their partner. And then finally, I don't think we as providers are doing a good enough job at asking women about their sexual pain. It's really easy for me as a provider to say, how is your sex life, or how is your intimate relationship with your partner or with your husband or whoever it might be. Being direct about asking about sexual pain is a little bit harder. So it might be a little bit more awkward for a provider who's not used to doing this to ask, do you have pain with intercourse? Are you avoiding intercourse because of pain? Are you getting help for this? Do you need help in getting help for this? How is this affecting your emotional well-being, your psychological well-being, your physical well-being? What other types of things, besides sexual intercourse, are you avoiding because of pain? And so, providers don't ask these questions for a number of reasons. Some of it may be that they don't feel that they have the experience or the ability to ask these questions in a way where the patients don't feel comfortable, don't feel embarrassed. Secondly, it's a time issue as well, with the host of other medical conditions or issues with which patients may present. Sexual intercourse may not be at the top of a provider's mind. But I think we all have a responsibility to address sexual pain in a way that's direct, that's specific, and gets our patients the care that they need. So sexual pain is one of those conditions in terms of who primary care providers should be looking at as members of the healthcare team. Sexual pain is one of those conditions where it truly a multidisciplinary approach is considered best practice. And so when I kind of think of my team of healthcare providers that should be involved with these patients. Now, this is not an exhaustive list, but this is typically, as a physical therapist, these are the professionals with whom I work the most closely. And so this may be a physician, whether it's a primary care physician, gynecologist, or urologist, or pain physician. Usually if I'm getting a referral from a physician, I'm going to be working closely with that physician as well. Given the number of musculoskeletal issues that women with pelvic pain demonstrate in terms of pelvic floor and regional muscle pain sensitivity compared to women that don't have pelvic pain. Physical therapists are often included as part of that team. And then finally, I think it's also important to include a sexual counselor or sexual therapist as well, particularly if there is some aspect of partner dynamics or relationship at hand that's being affected by the sexual pain. And a sexual therapist or counselor can work not only with that individual patient, but also with the partner in couples counseling to address these issues as well. Looking out over the landscape of pelvic and sexual pain and pelvic health in general, my primary concern would be women getting access to the care that they need, and that the access to care is not regulated by legislative policies and or third-party payers, insurance companies, and that truly women are able to directly access the care that they need, and that they have the funding and the means to do so, that they can afford this care as well. What makes me hopeful is I think there's a much greater emphasis and a growing emphasis on women's health in general, not just by people who we think of, typically as the women's health champions in healthcare, gynecologists or OBGYNs or pelvic health, physical therapists or sexual counselors, but a growing awareness of even, individuals in the health and fitness profession as well. After women have a child, what are things that trainers should be aware of when it comes to postpartum issues that women face? When women enter menopause, what are issues that we as healthcare providers in general, health and fitness professionals included, should be aware of when patients come to us for issues that they're having related to menopause? And so I think there's a growing focus and emphasis on that, and a recognition that women's health is important and it should be a focus, and providers should receive the education and training to effectively manage these patients.